Welcome to the 98% Arm Wrestling Podcast. We're here tonight with Regen Options, and they have been kind enough to sponsor our arm wrestling tournament once again. So we brought them on here tonight so that they could talk about what they do and the services they offer. So why don't you guys go ahead and introduce yourselves?
Oh, it's an honor to be here.
Thanks for coming.
Yes, hi.
Yes. I've given it some thought, and I don't think it's important to sell our office and tell you where we're located and all that other stuff. I just would like to tell you that there's a lot of stuff on the internet about regenerative medicine, and Big Pharma is not behind it, so there's not a lot of money behind it. And so that's the problem. So there's no proper statistics. In our office, we do keep statistics. I do know what's going on, what was the cause and effect, and all that. And I'm always still a learner. But I mean, Dr. Grossinger has had great, Dr. Stephen Grossinger, there's two of them, Dr. Stephen Grossinger has had unbelievable results with this. Doc, why don't you elaborate?
Sure. It's nice to meet you. I'm Dr. Stephen Grossinger. Just to tell you just a moment about myself, I had done internal medicine in the early 1990s and then got into neurology. And by about 2000, I started focusing on pain management. I do epidural injections, ultrasound-guided injections. It's about 15 years that I've been focusing on regenerative approaches. And it really, I think, is exciting. I think it's the future. Basically, using your own healing factors, your own growth factors, platelets, otherwise, to help you heal. Different body parts have been shown to respond well. It's basically harnessing your own healing factors and concentrating them, where you need them. We've luckily had some nice results, whether it be problems involving muscle, joints, ligaments, tendons, all the kind of things that arm wrestlers tend to put a lot of stress on. So I look forward to talking about the kind of things we can do to maybe help you guys out. And your people, I know that there are some great women arm wrestlers as well.
Yes. Which that is why I invited John and Shawn here, because they've used your services. So they can speak to that if they want and talk about what procedures they got done and the results and stuff like that. Two well-known guys in the arm wrestling community.
Well, John is. I don't know about me.
Details.
Do either of you want to start and talk about maybe what your injury was and what you had done for a procedure?
Yeah, I can talk about it.
All right, go ahead.
So I had a right shoulder tear pulling Mike Aiello in 2020. And I tore something in the front of my shoulder. I went to ortho and I did physical therapy and all that kind of stuff, and it didn't really get much better. And then I tore it additionally in a practice, I don't know, 3-4 months after that. So got to the point where I could barely use my arm. I could lift it to about here. That's all I could make it do. Wasn't working great for me. So I started hunting around for somebody who could do PRP injections because I had those previously for some other injuries. So my Google foo was pretty good, and I found Dr. Grossinger. So he's local to me, worked out pretty good, went and visited him. We did a PRP injection first, and that helped quite a bit. I mean, that got me range of motion. It got me to where I could lift weights a little bit, but I still had a lot of pain in it. So then we went back and did a stem cell injection. That's a little over a year ago now. And I'm at the point now where I'm back on the table full force with the arm, and I'm getting some good wins on some upper level opponents anyways. Back in November, before another problem I had in the surgery and whatnot, there was a day in November where I beat Paul Cruz 4 times in a row right-handed. So that's a pretty good opponent for me to be able to beat, because my right arm never was much good. It was really bad after the injury, but then since the stem cells, I'm actually back to where I can compete at a high level. So It's been impressive.
That's great. How about you, John?
Well, I was having trouble with my left shoulder. I had a partially torn labrum, and I was looking at having surgery. And about that time, Shawn, I saw the miraculous results he had from the PRP. And I said, wow, that's all I really needed to see. He went from couldn't lift weights at all to all of a sudden, hey, like he's starting to lift weights and the weights are starting to go up. So I was like, okay, that's enough for me to go try it. So I met with him. It was a painless procedure. It took a couple minutes and tried it. And then I went back and got another PRP injection, and it helped a lot. And it helped good enough that I went to the Jim Bryant Memorial Tournament. And since the turnout was a little bit less than we had hoped for, I pulled like every possible class. And I ended up injuring my shoulder worse. I probably shouldn't have pulled every possible class that I could fit into. And that's when we went ahead and we did the stem cell. And the stem cell made a day and night difference. And I actually had injured my knee. At the same time, we actually put some stem cells in that. That made a huge difference in my knee too. So I got like a 2-for-1 out of that.
That was a gift. That was expensive. That was a Dr. Grossinger doing an added nice thing that he does. I mean, that's what we do in our practice. If we get enough blood, we need to, if we're scheduled for one knee and you've got pain in the other knee, let's do it. Let's get it done.
Really, really.
If you have stem cells just laying around, you might as well.
Yeah, you know what? And, I wanted to focus on not so much the specifics of all of this, but I have two sons, 1 6'7", 1 6'4", and they both played sports. Both, my argument as a mom was you can't do football, basketball together. They did. So, obviously they had injuries, and, it was hard on their body. I would have paid money to make sure that they had something else before surgery, because surgery, once you go in, nothing is ever the same. And so when I asked them tonight, because I usually, I go to my children and go, because they're young and they know what's going on. And I go, so what do you think? And my older one said, Mom, nobody even knows about PRP. I mean, you're going to have to bring up Kobe Bryant. You're going to have to say, remember him? And then that's what they get it. Regenerative medicine is like all over the place. People don't know how expensive it is. They don't know what they're really getting. They're just looking for a fix, and it's complicated. And people don't. I mean, I'll give you prices online, but other people don't. 2010. If you look at, and I just found that because I had somebody else do more research for me, deep research on Kobe, and I can't believe how quickly he healed after so many not as many PRPs as I would imagine, because when wealthy people get PRP, they line themselves up for, let's do 6 in a row and that's going to be great. To my shocking value that I share with my team, I'm like, good news, guys, do the research. 2010, Kobe Bryant, he had PRP. He went to Germany, had PRP a year after, and he did amazing, and he's a superstar. I mean, rock star that everybody has adored and missed. And I just don't think that people even know or hear about it. And my one goal today is I don't want people to think, I know about regenerative medicine and and they're winging it. They can't wing it. Everybody's different. Everybody's different. The entire body, what they have in it, if they have medication, if they don't have medication, it's not going to be a complete fix. But if you're on the path of, I'm into my health, I'm into nutrition, and all you arm wrestlers are, I see you're all so fit. It's like, okay, you know what? This is a really good fix. I mean, it's a great fix. You don't have many options because steroids is going to take the pain away. And we do them all day long, but let's heal our body. Let's go. That's kind of my thought, and that was my takeaway. What do you think, Dr. Grossinger?
But when I was looking at some of the anatomy, physiology of arm wrestling and the approaches and just the amount of force involved, you know, and a competitive arm wrestler, obviously, you know, obviously like Shawn and John, they work out and they become incredibly strong, and it's a combination of their strength against someone else's strength. And as they know much better than I, the strategy of during an event, you know, during a match, that you're trying to either move quickly in a different way the other guy doesn't expect. So there's a lot of wear and tear on the muscles, the joints, the ligaments, soft tissues, and you know, it's to get through without getting injured is, you know, takes a lot. There, of course, like we've seen with John and Shawn, that when they're injured, they lose time, and then we work to get it back in the game. But it's also something to consider when you've tweaked something and you know it's limiting you, but you're still, you know, and you guys are all are tough, and you're not, unless you're really sidelined, you're going to go back in and you know, brute force and let the adrenaline get you through the pain. But it may be that doing it when things aren't quite on fire. I mean, at times, you know, I've of course through my career and even ongoing will inject steroids at times. I have come to the point that I consider like a cortisone or steroid injection as a way to put out the fire. You know, if things are really intensely painful, to try to calm that down, and may do that, and then 2, 4, 6 weeks later, then consider coming in with PRP or stem cell. One thing I'd like to clarify, you know, as the guy said, that they had some solid results with the PRP, but also then went on to stem cell. And really the main difference is, you know, PRP, which is platelet-rich plasma, is a simple blood draw. You know, it's like if you've gone to give blood to your family doctor, that's what the blood draw is like. Our staff then will put the blood in a centrifuge, concentrate your healing factors, and then it comes out in syringes. Something you may be able to relate to it. It looks like beer when it's been processed. We remove the red cells, and usually there'll be 4 or 5 syringes that then can be injected. That's PRP. The difference with stem cell is we do take it from the bone marrow area. There's an area in the low back. We go into the bone. We try to numb it as well as possible. But then once we have that, in addition to the concentrated and multiple growth factors and platelets that the PRP has, that there are cells that can differentiate. Means they can change. They can, and it's almost a cartoon-like explanation that it's going to become muscle, ligament. It's more that it induces your body to regenerate, to heal, and to try to grow back some of that. You know, as Carolyn touched on, you know, bone on bone is a really tricky situation. But again, that the being told that you have a bone on bone situation is looking at a plain X-ray and seeing that there's not much space there, but there is potential to augment the body's ability to make the fluids, to potentially augment the chondrocytes or cartilage cells. So you do get additional between having the bone marrow. There are more concentrated factors that can modify and really can step up your body's healing factors. And we did see of course, with both Shawn and John, that they really were able to go on and they're using those joints in a very intense way. One other thing I'll say is part of my approach is you know, I try to customize things on all fronts. You know, getting a history, doing an examination, and literally when we come down to the time of doing the procedure, I will take a skin pen and say, you know, where does it hurt most? So I will want to target where the pain is, but also keep in mind the anatomy of areas that I know tend to be trouble. You know, whether it be the acromioclavicular joint, like where the collarbone attaches to the front of the shoulder, whether it be deep in the joint, the labrum that John mentioned, he had some tear of. The labrum is, you know, we don't want to get too technical here, but bottom line is I will try to get to where the you know, common ligaments are, where important parts in the joints, But I also will target where the pain is itself. And it may be, you say it hurts here, it hurts here. I will be sure to put the stuff there. And I actually had a patient who was, when she was working, she was impaled, and basically a piece of wood kind of went right into her calf, and she had basically like a hole there that was chronically painful. And I did inject that, and it helped, and she had like 85% improvement after 2 or 3 injections, just as an example of the way the healing can rebuild. And your body gets to a point where it's content with where you are. You get a laceration, a cut, or a bruise, stuff happens, but then you get to a plateau. And really, this is a way of reminding your body that it still can do more. And I do love the idea of using your own stuff to kind of jumpstart things, and then getting you back in the game.
Now, is that like both of them going to you? Is that kind of a natural order of things where you would try PRP first and then stem cells?
There may be some situations where we might aim to go to directly to stem cell, and I mean there are realistically there are financial considerations, but often we will take that road. If we can get you better doing the simplest thing, and the PRP is a bit simpler. And we do even have other options, but we do try to customize things to a situation, but often it would start with PRP.
Yeah.
And it is a decision. Do we we have some circumstance where we may at 6, 8, 12 weeks or something may consider repeating it. And it may be, again, I think it's classic with both Shawn and John that they got to a point and really wanted to, I mean, you guys, there's one thing to get to the point where you can do day-to-day stuff. There's another thing to get to the point where you're really pulling against tough guys. So
winning champions.
Yeah, and another thing you got to think about with that, the procedures are very, very different between what you go through for a PRP and what you go through for a stem cell. Actually, injecting the stem cells is fine. That's not a problem, but getting them is not a fun day. So, even if you took the cost out of it, you want the PRP first.
This is coming from the tough guys, remind you, because these guys said nothing. They're fine, went through the pain, and they're okay. So keep that in mind. These are the strong guys.
But exactly, it is, there's different degree of complexity, different degree of discomfort. I recall Shawn had his tough moments there, but again, I guess looking at the big picture.
And result.
Yes.
Yep.
Oh, it was totally worth the results, but the puddle of sweat during the procedure was definitely noticeable.
Well, Shawn said I could use his stem cells.
I have extra put away. We're good.
Can you use someone else's stem cells, or does it have to be your own?
No.
Actually, we have a middle ground. Carolyn, maybe you could describe other options we use.
Well, all right. So here's the deal with that. There is like amniotic, cord, how if you have a full grown baby and you put the cord tissue away and you store it, and that's amazing. It's great stuff. The FDA is not happy about it. It's very controversial.
Yeah.
But I think it's amazing. But the problem was it didn't really work before, because even the stuff that we clean the skin with would kill the stem cells. So you have people saying, oh yeah, I had that cord blood, it didn't work for me and I had nothing. Well, we didn't know what we were doing. Like nobody did. So when you go, and it's funny because we were talking about, Stephen and I were talking about this today, and like, even if you go online, like the information is all over the place. It's everywhere. And Big Pharma is not behind the money to make all these great statistics and let them show like what works and what doesn't work. And for us, we're super cautious. Do we have cord blood? Yeah, we do. Do I offer it? Put it online? Nope. Not sure if you're going to do it today. But it's amazing. But there's been so many problems where people say you could inject it into your eyeball and then you can see tomorrow. And that's the problem with regenerative. I can't tell you how many patients I have that say to me, I mean, just desperately dying, going, this is the last of my savings account, and you know, I've had this issue and I think it's going to save me. And, you know, can you give me a price? And I'm like, nope. And I'll go with you with the next appointment, whoever says that they can. Because it's there's no specific information. There's information that it does heal the body, do have results. We have great results from it. And anybody that tells you different from that, it's not accurate. It's not, because it's just not.
Yeah.
You know, there's no, that's it.
Makes sense. Dan, did you have anything you wanted to add?
Yeah, actually, I did have a question for that. Because I actually did want to talk a little bit more. I know that there is a lot of controversy surrounding the other. You said with the from placenta, the stem cells from that. There's a lot of controversial issues with getting it from that. Why or what was it that people aren't seeing that, hey, this is being stored anyway, why can't we utilize it? Can you speak to that? Like, there was like I know there's like a mindset behind it.
But part of it, I think, also has been that it's been touted to be, you know, a miracle cure using for MS and ALS and Alzheimer's, and you know, it's given intravenously and really kind of in a slipshod way, or as Carolyn said, injecting into eyes. I think there's great promise for the scenario that we're talking about, where it's being used in a focal area, but we do have to be very cautious. I mean, frankly, I gave some. My mom is 87. I knew that if I were to take some of her, you know, her own stuff is old, and so it is an option to consider. You know, again, it's something more that we would discuss on a case to case situation. I mean, it's not best for us to put out a, you know, on the internet. And one other thing, just as a generality, you can listen to KYW or whatever, like listen on radio, and see that there are big companies out there that do advertise, you know, big time. I think if you delve deeper, you see that, you know, they do, you know, that there definitely is money to be made, and they're throwing, you know, I'm sure 8 figures at the concept. I mean, I remember someone saying they had 17 franchises of this place. I think in a way, when you look at the complaints for some of the places you hear about, then you sometimes hear the rest of the story between the price and the approaches and the training of the staff. I mean, realistically, I've been injecting spines and joints, you know, for 30 years, you know, and now fortunately I can combine my experience with other substances. So just something else to keep in mind as you know, it's a tough decision here, and there's some really good marketing out there throwing stuff at you between Facebook or wherever else. But you know, I think there is promise, as we see here. You know, I know we couldn't force Shawn to say something that he didn't want to say. So you know, I take, you know, pride and you know, it's been great to see how he's been able to get back and do the stuff that he loves and is so good at.
Absolutely. Now,
Just to touch on the tissue thing again, there's not too many labs that are FDA approved. So the lab we use is FDA approved. You know, so that's the bottom line. You know, and that's not. These are questions when I have a patient come in and they're like, "This is what's wrong with me," and some of them are highly educated, and I'll say, "Okay, you know what? I'm not going to sell them." I just say, "These are the questions I want you to ask everybody that you're going to. These are the things you need to know, and this is how you double check on what's going on, and then you can get a real answer." But there's no miracle, but it's definitely it's the future.
Right.
It's definitely the future. We're getting there. Close. You know, it's fantastic. I mean, look at you guys, you had great results from it. You know, and then keep in mind too that, not shock value, because I was shocked on this one too, that not, I don't want to say specifically, but just say other offices out there. I've had to ask, how can you do these procedures when there's no real doctor there? And you know what the answer is? Surprise. It is a medical director that's in the sky. So basically, whatever that person does, whatever their not skilled doctor does, can do all these procedures all day long, send them into the cloud, and then the medical director says, okay, we're good, and they're okay. And like, that's my fear, because now I have people going to offices like that, and it's everywhere. But
Yeah.
did you know that? I didn't know that. That's
I
new
did.
to me.
I actually knew that because I used to manage a place called Restore, and they offer a lot of the newer services that people do, and they only have registered nurses administering these IV drips, but they're under the permission of a nurse practitioner who has a medical director who oversees them, and so they had this whole thing. But like, they have one person overseeing an entire region in the country, and I was like, heaven forbid something goes wrong.
But exactly, and you don't have a doctor on staff, and we're not talking about an NP, nurse practitioner, or a PA that can legally do it and would be able to help you if something went wrong. But patients don't have a clue what that means.
No.
When I say PA, they're asking me if I'm talking about Pennsylvania, like, so they have no idea. And yes, if something goes wrong, there is no real doctor in the room, and I've seen it.
Yeah. So I actually do have a question, another one in regards to post-op, post-treatment rather. As a massage therapist, one of my biggest things is recommending other services to continue the care at home to see the best results. What are there any services that you would say that complement? I know you mentioned red light therapy. That's something that's kind of sticking in my mind that would help complement and maybe make the stick a little stronger and provide a more substantial results.
Shockwave, we're doing that now. I mean, we just bought a machine, and it's amazing. And the only reason we bought the machine is because we've had other doctors say, I can't believe the results. So, Doc, do you want to elaborate on that?
I mean, doctors who don't have a horse in the, there are great salesmen out there, but I mean, particularly the device that we got, which is by Zimmer, which is a kind of a household name in equipment, and actually my son's new uncle-in-law happens to be a busy podiatrist in New York City, who said he's been using it for 4 years and really has had great results on tough cases. So we took the plunge with that. One of the realities is that insurance companies don't tend to pay for newer effective treatments. So you sometimes have to pick and choose. Unfortunately, it's not, basically it's a 5-minute treatment once a week for 5 or 6 weeks. I think as we were discussing before, the part of the concept is to either improve blood flow, to encourage parts of the body to regenerate, which of course PRP and stem cell can do, but other approaches, mechanical or otherwise. We definitely often work closely with chiropractors and physical therapists and massage therapists, knowing that we may, whether it be with some steroid to put out the fire and allow more mobility and exercise, or tolerating more manipulative or other treatments, but we're definitely realize that a team approach can often be most effective.
Oh, definitely. It's just expensive for patients, but you know what? It's your health, and if you're working so hard to keep your body good, then that's the future. That's my opinion. Just got to keep it going.
Yeah. So at Winter Blast, I know me and you have been talking about it, trying to find a way to get people in front of you and interacting and asking questions. So we are going to try to shout you guys out a lot during the tournament, send people your way. I mean, I know about a dozen people always complaining about injuries. So, just hearing people talk about their injuries, like Dan, we can help you by suggesting that they come over and talk to you during the tournament or give you a call, even outside the tournament. I'm always trying to refer people to you so that you guys.
But the reality is patients are intimidated to talk about something they don't know. Yeah. And they don't know how expensive it is. Right. And they're afraid of stumbling. And so I don't have the answer to that. I'd love to. Right. I think that if you guys share that with them and say, all right, here's the deal. PRP costs about this much. You're going to get a break because you're with Dr. Grossinger, and he's going to do a great job because he's got the history of doing it.
Yeah.
That's our best angle. You know, I mean, that's
Right.
and that's the best way to help everybody.
Absolutely.
Yeah, I get a lot of people asking me about it because I've been really public about the stem cell therapy that we did.
Mhm.
And I've gotten a lot of other athletes coming to me and asking about it. And I mean, I've given Dr. Grossinger's number out to probably 40 people. I don't know if any of them have ever actually shown up there or not.
If he doesn't
But I
copy
do get
me
a lot
on
of
it, then
interest.
he doesn't know.
But
He's super busy.
I do get a lot of people who are interested and a lot of people asking questions about it because they saw me injured, then they saw me back.
Yeah.
And I've been very clear about what caused that. And I do get a lot of other people coming to me at tournaments all over the place and going, "Hey, how did you do that? Where did you go?
That's awesome.
Can I have the guy's number?" You know, so I've been pushing that out there as much as every time somebody asks. I don't know if if any of those folks are actually taking that leap to actually go get themselves fixed, though.
And maybe John, maybe Shawn, if you even can text or email Carolyn, and sometimes us calling and saying, we understand Shawn told you a little bit about this, and we'd like to have a discussion and help you get over those barriers. But that would be fantastic.
Well,
Yeah, sure.
here's really the bottom line in other offices is everybody wants you to get them in there, and so they can sell you on it, and they're just going to take your money, like, okay, regardless. And I don't do that. I'll have I do a consult on the phone, and I offer it. I say, would you like to come into the office, or would you like to do it over the phone? The first way I start the conversation is, I'm going to give you a price. I'm going to tell you exactly how much it's going to cost, but I can't unless I know I can help you. Because if we're going to talk about your ailment, or even, I mean, we do a lot of different PRPs for a lot of different things. I need to know what's going on.
Yeah.
And so then after, an hour of going through everything and, okay, I'm going to email you the results and all that, of course it builds trust, but then we're not doing something for somebody that we can't help either. You know what I mean? So
Yeah.
that's
you-
kind of the way I
Do
do
you
it.
have people call
Call
you?
me, I'll tell you I'll tell you how expensive it is and tell you if I can help you or not. And
Yeah,
then I
awesome.
consult with Dr. Grossinger and go, what do you think about this? And
Yes.
usually
So you
we're on the
guys
same page.
You guys get people that call with an injury and you're just like, this would not help that injury.
Exactly.
Whatever. Yeah. Gotcha.
Transparency.
I have MS patients that are desperate for pain relief that say to me that have been have had no issues for 10 years and say, I heard this miracle thing, I'm passionate about this because I care. I heard this miracle thing, the stem cell, I'll pay any price. It's the last of the money I have. That's never going to work. That is why this whole situation got into a bad vibe of it. But if you watch online, all the big players, everybody's moving towards regenerative medicine. It's happening. Just big pharma isn't behind it, so there's not a lot of money behind it, but it's happening.
I had a patient that I found to be really interesting. Actually, he came to me for a second opinion. He was a baggage handler for American Airlines, had an injury to his hip. He showed me a picture on his phone that there was a screw through his pelvis. He had hip pain. He did research himself, and kind of like Shawn, he felt that he wanted to have stem cell. He, I guess, tripped across a place in Williamsport, Pennsylvania, where the Little League World Series is, and this gentleman lived in Delaware. He ended up, and interestingly, he was on Medicaid. I mean, he clearly, was financially had limitations. Though he did pay over $5,000 to go. And as it turned out, it was a nurse practitioner, and it sounds like they tried various things. And frankly, when it came to me, I probably could have said, well, I could probably give you a $10,000 treatment that might be better, and you can just dig deeper into your savings. But I really felt like, looking at the whole scenario, that a hip replacement was best for him, and that's what I recommended. And I said, I mean, frankly, again, the hip is different than the knee and shoulder. Some people do really well with hip replacements. Some people do really well with hip PRP and stem cell. But again, we as Carolyn says, we listen to people. We care about people. I mean, I think that's kind of our starting point. We really are driven to help people, and then take from there to see if things we can offer seem like they're a good fit.
I actually reached out to Dr. Grossinger 5 or 6 months ago And I asked about doing stem cells for another injury, and he told me no.
Well, I don't think
I've already been there for stem cells. He told me no.
it doesn't help with brain injuries.
Actually, it was for my lower back. I see a lot of advertisements, and these are probably the places Carolyn was talking about that are out there advertising all the time. And I see all these advertisements for using stem cells for low back pain. So I don't believe any of them, but I said, okay, let me talk to Dr. Grossinger. So I reached out and I said, hey, is this something that would be beneficial for me? And he said, no.
That's good.
And I think part of it was because your nerves were irritated. We ended up having our anesthesiologist. It sounds like he was able to, doing a selective nerve root block, was able to at least get a bit to there. I mean, there are some rules for stem cell. If you said, "Oh, my pain is right at my back," again, we look into the particular scenario, but again, as you say, we want to try to pick what makes most sense.
Yeah. And I mean, he already had me on the hook. He could have told me yes, and I would have believed him based on the past experience, right? So, think about that one.
Well, I think that's what makes a difference, because if Shawn had went anywhere else, they probably would have been like, sure, come on in. Give us
I'm sure of it. Yeah.
They'll take your money.
See it all day long.
Right. So, I mean, that says a lot to your integrity.
So
Right.
that also speaks to a big point that I drive home to all my patients and clients in massage therapy, that your wellness is not a luxury. You guys are driving that home. You guys are driving that home big time, and in a very special way, because in a society that we've been conditioned to invest in our cars and our homes, but if you look at the bank account and see how much you've actually invested in your own wellness, you'd be like, oh, maybe I don't do as well as I should. And people don't realize that they've invested hundreds of thousands of dollars in all this other frivolous things that really disappears after 10, 15, 20 years at most. Your body's with you for their whole entire existence. So I love it. The providing what you guys are doing is crucial, and I'm definitely eager to learn more, and I got a couple of my own issues that I would love to address with you guys.
And you know what, to touch on that, there's a lot of us that doesn't take vacations for years and years, too many years, and then sick and pushes yourself and doesn't even know what that's like. But there's a lot of other countries we can learn from, because in Japan, when I was pregnant with my first son, it was a normal thing to get a massage. And the way it worked was, it was super cool. It was an older woman that would come in a yukata, which is just a cotton robe. And the big thing was, you have to be laying him down, ready in bed, and then you leave the money, which was $30 or something, and get your massage, and then you have to go right to sleep afterwards. And then she left their house. But they understood that that's wellness. It's not a privilege. It's not because we have extra money. It's your body, and it helps. And it's so cool. I mean, my gosh, the thing, if people could learn from all the other countries, especially some of the things that I've seen, I mean, we all could learn so much. But massage therapy, oh my gosh,
It's treated like
so much.
It's like it's treated like a commonplace, like brushing your teeth, like it is here in the States, anywhere else in the world.
Yep. It's just that we look at it as a luxury in America, going, okay, the rich people can do it. And then we have the older people that don't want to go in there. And then the other ones don't know if they have to be naked or not. That's a big deal, and I know. And so my plan is to add that and show pictures, like show somebody like you and see the patient. And you could choose to be in a yukata. I'm not really sure if we can get them here in America. I mean, can, but but they basically don't have to be disrobed. No. And they can get the massage, and it's just so good for their body. It's so good for their blood flow.
Without a doubt. And that's the greatest thing about being a massage therapist, knowing how to adapt and customize the treatment to them. And it sounds like you guys do the exact same thing. So I can admire and appreciate that at a very high level, because that's what I do.
And the quiet one that's not talking, he's an acupuncturist. The big doctor that went to years and years of school. That's his thing.
I wanted to have another modality. I really prefer not to write for medication when I don't have to. What I've done, and it's kind of jokingly, but I think I want to formalize, is lighting my prescription pad on fire and just forcing me to use other modalities. One thing I do want to say is that your health is your most important wealth. if you have, tons of money and you can't get out of bed, then it's not much worse, or I mean, not much, it's not worth much. If what you love doing is pulling, and because they're pain in your elbow, your wrist is holding you back, and you lose months of that, or you just do it into pain, maybe, and one of the things, we can be also flexible in payment approaches. So we want to take people's situation into consideration, but in the big picture, we want to help your health span as much as your lifespan.
Of course.
Is that a common limiting factor, like people not being able to afford it? Or
well, I think one thing also is that people pay a lot for insurance at times and feel like they want to get whatever they can with their magic insurance card, and there are things that we can do. It may be that I do nerve testing to see is it a pinched nerve, try to localize that, and that is something that is covered.
Right.
So we do participate, but realistically, I think if Blue Cross Blue Shield were to say, sure, we're going to pay for PRP, they'd probably just fall over, just because the demand, would be so high, or probably tend to mess it up. So in a way, I guess it, maybe part of it is also that it does select out people who prioritize their situation enough. And, as Carolyn has touched on, we will discuss nutrition, we'll discuss other angles, and hopefully we can, play a role in getting people healthier on all fronts, including getting back to whether it be, of course, being able to work, being able to do social activities. I mean, frankly, pain sucks. Getting people out of pain just it's very gratifying. I mean, I feel like my mission statement is to try to help people that haven't been helped other places, and it's been very gratifying to be able to do that.
Just want
had to drop off, but he said to have fun.
to tell you, it's been more mainstream. Is I had some high-end dental reconstructive surgery, and part of the service was PRP treatment for the gum reconstruction.
Yeah, one of the things that PRP can do is augment healing, and that's why it plays a role there. I was also going to just touch on another pretty high-profile guy in town, Bryce Harper, when he tore his the collateral ligament, he went and had a PRP. Nothing works for everyone. It was definitely worth a try. I mean, he has $300+ million, and at least he gave the PRP a try before going to surgery. But yeah, as John said, it does have other uses that frankly, it's something that I'm going to maybe try myself to see is maybe if I can get some of the hair back that has eluded me lately. It does have some cosmetic values. Some others that we can tell you about more privately, shall we say.
Hey, now they can tattoo hair back on you. No, but I appreciate you guys coming on, and like if we can bounce things off each other, ideas and anything we can do to collaborate on getting more, I guess, like not necessarily more patients, but more people to come over and talk to you to see if it's a good fit.
That's my
goal. And we could even, the nice thing about Zoom is we could put together a call where we have a bunch of people, and maybe at the same time we can be give a little bit of an educational and address people's questions. So it's nice to have that as an option as well. That might be a good way. We could show some we intentionally, we're not trying to be too medical, not talk too much medicalese, but sometimes diagrams just to show and maybe give a clearer idea of what options are.
I mean, I could put out something so that specific people that come on are people with injuries, so that it makes sense to talk to them and see what's going on, and yeah,
because we're trying to talk to a lot of people at once and just get the word out that this is an option. But I think getting more specific could be fantastic.
But you have to remember the big thing.
We can just have a Zoom.
Right. But you have to remember that the big picture is, I mean, I can talk about money and how much things cost and all of that. But
Yeah.
when Dr. Grossinger talks to a patient, he has to rule out the big stuff.
Yeah.
He's got to make sure that there's nothing huge happening here.
Yeah.
And
Yeah.
that has to go through their patient history, and it takes some time.
Yeah.
And so
Sometimes
like
it's been
you
all-
can't like diagnose going, oh yeah, but it'll
Yeah.
help, because he's always thinking the other way.
Yeah. And I'm thinking more like they could ask some questions about the procedure, like, oh, does it hurt? Or
Oh yeah,
you know,
yeah,
things
definitely.
like that, and get them talking so that maybe in their mind it becomes an option where they're not afraid to approach you guys.
That makes sense. That's
You know?
perfect.
You know, just break the ice, you know, definitely.
Yeah.
Because
And let them know they can call me. I'll go through what's going on. I'll give them an idea about because it usually starts with the price. I don't know what I'm talking about. I'm scared this might be able to help me. How much does it cost? And everybody else says, well, you know, if you come into our office and you make an appointment, you know,
No.
9 times out of 10, they're not going to do it. My job is go through it, figure it out. Okay, yep, we can help you. They see Dr. Grossinger, and there is no sales after that because it's referral. It's just like you guys. You
Yeah.
know, it's if somebody's helping you and they're doing the right thing and they treated you properly, and you know they shared about the money and okay, this is what it cost and helped you. There's no sales. I mean, that's just where they're going to go.
Yeah.
I do take great pride in the you know, looking at my reviews and what 80 to 90% of people say is that our staff, our team, you know, I think if you do come to our office, you know, between Carolyn and frankly give Carolyn credit because she put together a team of just great caring people, and that, which I guess is another part of you know, the experience which
It's a team.
proud to-
We function because we have an entire team that cares. And again, going back to Japan, because I spent 7 years there, is their culture is from the bottom to the shacho to the top. Nothing can happen unless you work as a team. And that's exactly right. Like
Yeah.
that's, I can't speak for everybody, but that's the way our office works, is they work as a team. They're
And
respected, they're loved.
I know, like me, like if I'm looking into something, first thing I do is check reviews. So, you know, like I'll read the bad ones, I'll read the good ones, you know, see what's going on, and you can get a good feel of what's going on at a business or an office
Absolutely.
based on the reviews. So that's important, and that's great that you have built a staff that's causing people to leave good reviews, and you know,
They are amazing.
yeah, it speaks a lot to what you guys are doing over there. So, but yeah, you know, like I said, any ideas you guys have, if you think of something, like sometimes we're just brainstorming and we're trying to think of ways, you know, to give you worth sponsoring our events, you know, so that you know, like, okay, that was worth it. You know, they're trying to promote. So like, there's a lot of things that, you know, moving forward, we're trying to do to attract attention to our sponsors and stuff like that. So.
Well, we're excited about the Winter Blast, and I'm bringing a nurse practitioner with me, and Dr. Grossinger, hopefully, if he doesn't have some medical emergency, that tends to happen sometimes.
Or if my wife lets me come.
Yes.
Well, we're going to try to get you arm wrestling this time.
Okay, I have to get John to give me a little some technique.
John will give you some tips. And then
John was thrilled about it.
Then again, my
if you
these
get
hands
hurt,
are-
if you get hurt, you can heal yourself.
yeah.
There you go.
Well, wait, I'm not sure if you're going to keep this on here or not, but the one thing, after all the research I've done on arm wrestling, it's unnatural to move your body in these ways. It's just not a natural function. It's not. And
There's
so
nothing natural.
you have to deal with, you did unnatural things to make it work. And like that's really that simple.
A lot of torque on things that should not get that much torque.
It's not even a normal function, guys. I mean, I know you love it. It's a great hobby, but just like you have to like look at that going, okay, yeah, well, there's going to be some consequences there.
Do you know how many of my colleagues look at me and like, wait, you do what with your arms? Don't those your money makers?
I could,
but I do have to say, it's a lot better than the new trend for the slap in the face thing.
Oh God, I hate those.
I mean, as a concussion
awful.
specialist, please, you know, that's
No.
that's a great way to become demented quick.
whenever someone says like we arm wrestle, they're like, "Oh, do you do the slap thing too?" Like that's like the first thing they think of, and I'm just like, "Oh man,
It's absolutely ridiculous.
yeah." But that's funny.
I definitely want to get on the phone with you guys to discuss my shoulder issues and going forward as to how I can what I can do to better repair it, and because I kind of hit a standstill with my recovery on it. So yeah, all the things that I know how to do and the recovery methods that I know, I'm kind of at my wit's end with it. So
Looking forward to helping any way we
well,
can.
we'll
Dan.
help you.
In
We help everybody.
in the arm wrestling world, I could get you a lot more customers if you guys got into psychology.
No, we're not doing that. Do you know how many patients that I won't deal with because I know they're crazy? Nope, we won't. We're doing O shots and P shots. Google that. It's not something I want to talk about right now. But I'm at the point where no strippers.
Yeah.
Nope. I do not have any.
Hey, don't knock them to them.
You
They're
have to
hardworking
be
people.
crazy. You have to be a little bit crazy to arm wrestle in the first place.
Oh,
it
I'm
does take
sure.
a certain breed of person.
Yeah.
I'm sure. But the psychology thing, yes, every single doctor's office could use it. We'd all be better people.
I think it is half of our business in a way, but we do
Yeah.
bad shit crazy, shall we say? That's a technical term.
Yeah, and
I find
about 2
myself
years
saying I'm
ago,
not that kind of therapist.
about 2 years ago, I tried to, okay, you know what? I'm going to get a psychologist in here because my plan was to get the patients to talk to them because they all love Dr. Steve and get all their talking out of the way. And then they can see the doctor and really get down to business. So yes, every office needs one.
But it can be a bottomless pit, though, of course.
Yeah.
All good.
But all right.
Thank you for having
Thank you,
us.
and we'll see
Really
you.
appreciate it.
Last.
Thanks so much.
Thank
All right.
you.
Have a good night.
See you.
Good luck, guys.